My name's Paul Monaghan. I'm a partner at Allford Hall, Monaghan Morris, and we're the architects of Kentish Town Health Centre. So on the site originally there was a health centre that was quite celebrated at the time. It was built in the early 70s. It was featured in the Architectural Review in about 1972, so it was a very unusual building, a concrete building, very simple building, 2 stories high, with a very complex plan. In a way, that's what we've aped here. One of the key features of the original building was a passageway that was a right-of-way across the site. And in our competition entry, what we turned this into was a street right the way through the middle of the building. So you can walk through here even if you're going to the surgery, if you're going for a coffee, if you're picking a leaflet up. Effectively it's open as long as the surgery is open. And what we wanted out of that was to break down the sort of institutional nature of healthcare buildings, because that was very important to us. When we started to build this building up, and it's a big building, we started to be presented with problems. On one side we needed to get a car park in, which was quite big and taking up a lot of the site. On the other side we had protected trees, which were difficult to build over. So what happened is the bottom of the building is very small, and then it totally cantilevers out on the first floor. What this does is allows the car parking on one side, on the other side it allows the trees to get very near the building. In certain places the trees actually touch the building. Now what we then added onto that was the idea of Jenga, the parlour game. It's almost like a metaphor for the way all the different departments within this building, from the dentistry to podiatry to the children's services, and they are pieced together like pieces of Jenga and pull out and pull in. And literally the building does that on the outside, so it's quite a literal representation of that Jenga metaphor. I think on the outside of the building what we've kept with is quite simple palette of materials. Again, the budget constraints on projects like this are always very tricky, so what we've got is a repetitive window, very simple square window, which has a yellow or sort of lime green expanded metal panel which allows air to come through when you open the panel behind. On the base we have a quite dark brick, which we felt was grounding the building, and that goes through to all the external surfaces as well, so there's a whole brick plinth of the building. And above, the floating elements are sort of white render. Within the building, effectively a very simple palette of materials are complemented by the fantastic graphic art that Morag Myerscough has created, either within the street itself or even down to the banal level of the doors and the door numbers when you go into the consulting rooms themselves. I think the main waiting room that's just behind us now is my favourite part, in particular this external space, which is a way in summer for people coming out and having a more peaceful environment. The waiting room in a doctor's surgery can be a very intense place for some people, and I think you need lots of different atmospheres within it, and I think this space really does do that. Also what you get within there is the buzz of the building working, so you can see and point up to the dentists, you can see where the consultancy rooms are, you can see where the kids go, and I think it's that sort of central heart that creates a real buzz for the building and makes the building, if you like, sort of act like other buildings don't. So obviously this is the second year we have been on the Stirling Prize shortlist. Last year we were favourites for a lot of the time for a building called Westminster Academy, which was very special. I think there was something very special for us to be on that list that first time. It was very different. I think this year I don't know who's the favourite, because it's such a unusual list. But again, to come back a year later, we're very proud of that fact, and particularly in what's been an incredibly difficult year for all of the architectural practices in the country.